morning, everyone, and thank you so much for coming to this webinar today. So my name is Dr. Megan Weir, and I'm a research fellow at the Centre for Social Impact and the lead researcher of the Australian Social Progress Index. So before I start, I'd like to acknowledge that today I'm on Gadigal and Bidjigal land. And one advantage of moving to Zoom meetings this year has actually meant that I've been able to get more familiar with different countries and custodians where my colleagues and connections are living and working. So Isabella, can you introduce yourself and tell us what country or land you're on today?
Hi everyone, my name is Isabella Saunders and I'm a research assistant at CSI. I've also been one of the primary researchers of the Social Progress Index over the last couple of years. Today I'm on Gadigal land and I would also like to pay my respects to their elders past and present.
Thanks, Isa. So when we think about progress, often it's with the intent of looking forward to the future that we want. But in order to have a truly progressive society, we need to also be able to look backwards and see where there have been historical injustices for First Nations people in Australia and recognise the ongoing impact of colonisation, including things like the stolen generations, dispossession of land, and decades of stolen wages that has led to and had an impact on Aboriginal and Torres Strait Islander people to this day. We cannot have a progressive society unless we are willing to confront these uncomfortable truths and histories and disrupt the systems that allow marginalisation and disadvantage to continue. So with that, I would like to pay my respect to elders past and present, both on the lands where I am today, but also across Australia, and including any Aboriginal or Torres Strait Islander people that may be joining us today. And I'd also like to recognise that we are meeting on land where sovereignty was never ceded. So for those who are less familiar with the Centre for Social Impact, we are a collaboration between the University of New South Wales, Swinburne University of Technology and the University of Western Australia. Put broadly, our aim and purpose is to catalyse positive social change. And this means taking an honest look at our society, where there are disparities and injustices, and our focus is on equipping communities and organisations with the skills to be able to work together for a more equitable society. A major project that we're currently undertaking at UNSW is called the Amplify Social Impact Project, where we aim to help the for-purpose sector better understand our current society, its needs, and the ability to respond to social issues. And one of those focuses is on economic inequality and its impact on social progress. So Australia, compared to the rest of the world, has been, up until now, an undeniably economically successful country. So up until the COVID crisis, we had seen continuous economic growth in our gross domestic product, or GDP, over the last 29 years, including relative stability through the global financial crisis of 2007-2008. This means that we have young people who are completing high school and university and entering the workforce in social conditions where there had only ever been growth in their lifetime. The economy, keeping it strong and making policy decisions that first and foremost centre the economy, remains a strong focus, particularly for our current government. When we reflect on last week's budget announcements, the spending is largely focused on supporting businesses and infrastructure to create jobs. Tax cuts to businesses have been passed in order to, and to quote, rebuild our economy and create more jobs by kickstarting activity in the private sector. If we reflect back to earlier in the year, the government's response to the devastation of the bushfires across Australia and Australia's response to climate change was similar. Any response, first and foremost, must not jeopardise Australia's vibrant and viable economy. This has been a strong focus both globally and in Australia as governments respond to COVID, where there are calls to ensure that the economy remains open. But in advocating for this, we have to grapple with the ethical decisions about whether the economy or infection and death rates dictate policy. Australia has done remarkably well in its response to COVID by responding quickly with lockdowns and funding primary healthcare. But we are seeing increasingly that policy priorities are reorienting towards the economy. An issue that more people are becoming aware of is that by talking about and focusing on Australia's economy and GDP growth can feel kind of off when we're dealing with the realities of the communities where there are high levels of financial stress, homelessness, or untreated illness. There is an issue if we are only talking about GDP per capita and using that as a sole indication that the needs and circumstances of all communities across Australia are therefore progressive. So how we generate an economy and its flow and effects also matters. While the economy is not a person, it's driven by people within that system, and our work leads us to be critical of assuming that the economy is a benign entity of its own. So during the 20th century, and I think still continues to this day to a certain extent, there was an assumption that economic development automatically generated social progress. So if GDP per capita was going up, so was the progressiveness of a society. However, we know that in many instances, economic development doesn't automatically result in social progress. And in some cases, it can even harm social progress. So a relevant example that I often think of for Australia is the impact of the mining boom on the environment, but also the impact it had on communities where mining companies have resided for a few years and then left once the resources have been fully mined. Other ways of generating income, such as the exportation of arms and privatization of prisons, undeniably can also have a negative impact on individuals either here or abroad. And the relationship is not necessarily a one-way stream either. Sometimes social progress affects economic development. The state of basic education and health in a region could have impacts on how fit and able the workforce is, for example. So in order to truly understand inclusive growth, we need a measure of social progress that is independent of economic measures that we can then correlate against the economy, but also means that our understanding of the society is less muddied by dollar values. So the Amplify Social Impact project at UNSW has partnered with the international not-for-profit, the Social Progress Imperative, in creating Australia's first Social Progress Index, or the SPI. The SPI has been calculated at a global level since 2013 and gives an indication of how countries relative to one another compare on its ability to meet the basic human needs of citizens, to enhance and sustain quality of life, and create conditions for all individuals to reach their full potential. So this is our definition of social progress that we're working with. It's these three domains, basic human needs, foundations of well-being, and opportunity, alongside the economy, that we believe will lead to truly inclusive growth. An important part of the index is also that in order for social progress overall to improve, each of the domains must improve. There is no one concept that is more important than the other. A fundamental argument then is that when we think about responding to crises such as COVID-19, we can't think of it solely as an economic crisis or only as a health crisis, but instead need to be thinking about how we respond to an intersecting and complex system of economic, health, and social problems. For a resilient and inclusive recovery, we would want to be hitting each of these four areas to ensure sustainability building blocks are allowing us to use the structure of an inclusive economy and society that can also better prepare us to respond to crises in the future.
So the Social Progress Index offers an accessible and actionable assessment of the health of society that is completely independent from economic measures. So it's a framework that aims to capture not just present challenges and today's priorities, but also the challenges that countries will face as their economic prosperity rises. The index reveals relative performance compared to a country's economic peers and assesses a country's success in turning economic progress into improved social outcomes. So it's distinct from other tools in that it includes only social and environmental indicators and measures outcomes instead of inputs. So this means that when we were doing the Australian Social Progress Index, we were less interested in, for example, how much money was spent on a campaign to enrol more children in preschool, but instead we focused on the proportion of children who ended up in preschool. So the index offers what we call universally important questions. So these are concerns that are relevant to any country, state, or territory that's included in the Social Progress Index, and any indicator that we included needed to be aimed at addressing one of these questions. So over the last 18 months, we've been going through a process of consultation with academics, members of the for-purpose sector, businesses invested in the Sustainable Development Goals, and also local government to really think about what we could use as indicators to best answer these questions. It also wasn't just a question of what indicators we should include. It was also a process of working out what data was actually available in Australia, We needed to use data sources and indicators that were being consistently measured across all the 8 states and territories of Australia, and also ones that were updated annually, as we did a time series between 2015 and 2018, which definitely turned out to be a much bigger challenge than we expected. So this process of identifying the indicators that were available and setting the limits of what we thought would be the best and worst case scenarios for Australia's social progress led us to this that you see here. So this image shows how Australia's states and territories are performing relative to one another on overall social progress. So it's important to make clear here that these scores are how socially progressive the society and its policies are, not the people that live there. So we were able to calculate, as I said, the SPI scores between 2015 and 2018 annually, and then rank the states and territories on both overall social progress, but also on each domain and component within the SPI framework. So as a brief overview, between 2015 and 2018, we did see some consistent trends. So ACT was consistently the #1 region each year, and Western Australia and the Northern Territory placed 7th and 8th respectively. Also, these scores are for the state or territory as a whole. In future, we would hopefully be able to calculate an index that reflects things like remoteness, cultural and religious differences, experiences of people with a disability, etc. So each day this week during this series of webinars, we'll be focusing on a different state or territory and exploring their SPI scores. So we'll do a deep dive into their scorecards. So that's where they ranked compared to other states and territories. And then we'll also look at individual indicators and which ones scored particularly high or low. We've also mapped each state's performance with their policy responses to COVID to see where there are existing vulnerabilities in the state and then how the state government responded during the pandemic. We will also then cover how the SPI relates to the Sustainable Development Goals. But first of all, we wanted to contextualize and focus on Victoria. So for those of you who are living in Victoria right now, some of the scores from the SPI might make sense, and then others may not reflect your exact experience of living in the state. So we definitely are keen to hear your thoughts and feedback on that. And this is how we can end up making the index better in future years that we do it. So when you think about Victoria as a state, how would you describe it? So feel free now to put in the chat there how you would describe the state or the community where you live currently. So we did a quick whip around our office and we came up with a couple of these descriptors. So some people said the world's most livable city, that it's seen as really progressive or liberal, that it's known for having 4 seasons in a day, and also one of the most multicultural states in the country. So these are the impressions that we have as outsiders to Victoria. And it has been a really interesting process of aligning perceptions of a place against then the actual scores and the data that we found.
I think an important thing to talk about before we dive into Victoria's scorecards is to acknowledge and recognise this inherent tension that kind of exists between perceptions and data. One thing that we notice when talking or when asking about perceptions of a state or territory is that very often we are actually describing the capital city. So the cafe culture, progressiveness and multiculturalism, when we talk about Victoria, are often used to actually describe Melbourne. And that might not represent places such as Melbourne or Warrnambool, or it might. And that links to the second point, that location matters. So as Isabella mentioned, due to data availability at this stage, we were only able to calculate an Australian Social Progress Index at a state or territory level, which inevitably leads to a smoothing effect. You're seeing averages across the entire jurisdiction rather than being able to detect nuance that exists between metro and remote areas, for example. This is a definite goal that we have with moving the SPI forward, and it's to invest in data collection and measurement so that we can start seeing how different local communities across Australia are faring on social progress. The other thing to note with the SPI scores is that each score is how Victoria is performing relative to all other states and territories in Australia. So this means that there may be instances where there is area for improvement in Victoria, for example, access to community mental health care. But based on the available data, there are actually jurisdictions that are having greater issues in delivering good services. Another important point for me that I want to express is that we often talk about data as if it's this apolitical or neutral tool. But what we measure and how we measure it actually really matters. If we don't measure the impact of a social problem, it's then easy to say that it doesn't exist. Similarly, how we phrase a survey question or the way that we present data contributes to a particular narrative and interpretation, which then guides policy and decision making. So I'm definitely not saying that the SPI is not part of this phenomenon of creating narratives with data, but instead I'm wanting to encourage both within myself and others who use and talk about the SPI to also be willing to critique how it is that we collect data, and through discussion identify priorities or gaps in data collection and advocate for that in the future. Finally, an SPI score is not an indication of the socially progressiveness of, The SPI is an indication of the socially progressiveness of the policies and structures within Victoria, not the people living within it. It's also the case that individual lived experience may be vastly different to the picture painted by the SPI scores. And we don't want to invalidate those experiences, but instead it's our hope that we can use the SPI framework as a way of understanding how basic human needs and foundations for well-being and opportunity are not being met, and together work towards solutions for better policy and decision-making in the future. So to start off this week, and because Victoria is on a lot of our minds at the moment, we're focusing on the SPI scores of Victoria. So when understanding how an individual state or territory is performing in components of social progress, we can look at the score relative to its economic peers. This is relevant because of the two-way stream with economic and social progress. It's not reasonable to assume that less wealthy jurisdictions commit the same resources to policy as wealthier areas. And so these scorecards help us to understand how a state or territory is performing relative on social progress relative to the 4 closest states or territories in terms of gross state product per capita, which is our more localized version of GDP. The shading in the scorecards indicates performance. So yellow indicates an SPI component score within 1 standard deviation of its peers and indicates that they're performing within expected ranges. Green is a score that is greater than 1 standard deviation from its peers and indicates performance that is better than expected. And red is for a score that is more than 1 standard deviation worse than its peers and indicates performance that is worse than expected. It's not possible for every state to be performing better than its peers, but ideally we'll get to a point in Australia where we can look at all our scorecards and they'll all be yellow. But thinking about Victoria, overall they performed quite well, scoring within expected ranges for most components, seeing the yellow dots across the scorecard, and better than expected for nutrition and basic medical care, personal safety, and health and wellness. However, Victoria is underperforming overall in the opportunity domain and is particularly showing a worse than expected score for personal freedom and choice. This may seem surprising, especially considering Victoria is often the progressive and liberal state, but this score shows that the SPI can uncover existing inequities in a jurisdiction that aren't always considered, particularly when looking at the individual indicators that we use to measure personal freedom and choice. So in particular, for this component, one of the indicators looked at was the rate ratio between Indigenous and non-Indigenous children in out-of-home care, where Victoria is currently at a ratio of 20 Indigenous children to every 1 non-Indigenous child. This shows us that while Victoria, and in particular Melbourne, is seen as progressive and encouraging a just society, there are also cases where there are existing policies that are disproportionately affecting marginalised groups and creating deep-rooted inequalities.
In looking a little bit deeper into the individual indicators used to create the scores for each domain, we can see where Victoria performed particularly well compared to its economic peers and where it performed worse than expected. So as mentioned by Megan, Victoria has had one of the worst scores for Indigenous disparity in out-of-home care, with Indigenous children in care at a rate of 20 times more than Indigenous children in 2018. Victoria also performed worse than expected on feelings of safety on public transport. So we use this indicator to measure personal freedom and choice under the assumption that public transport is a general right, and when certain groups are excluded from safely navigating those public spaces, they're limited in their freedom. However, Victoria did also score particularly well in a number of indicators. So most notably, the rate of community mental health treatment was particularly high across the state. Crime rate was really low among youths. So were the number of reported physical assaults. So these indicators contributed to the high scores on personal safety and health overall.
So we released the index in February this year with the intention of engaging with individual state and territory governments to discuss how the SPI can be used as a way of determining policy priorities and addressing areas of social progress that were found to be particularly vulnerable based on their scores. But like a lot of things this year, the plan got interrupted when COVID became a bigger threat in Australia, and we shifted towards working remotely, as well as government and university priorities significantly shifting in a short period of time. But one thing that we did notice is that it's difficult understanding and interpreting various policies and stimulus packages when they're being released daily. And the SPI framework actually became a really useful way for us to understand and interpret what was receiving attention and was being understood as the big issues of COVID. So we make two assumptions here. The first is that where a government chooses to spend its money is indicative of where it places its priorities. And the second is that we should conservatively expect that without targeted policy attention, pre-existing inequities are likely to deepen when going into a period of crisis such as a pandemic. So what we did then was look at each policy or stimulus package that was announced at both state and federal governments and judged whether the policy fit within a particular component of the Social Progress Index framework, or whether it was a measure that was focused only on the economy or employment. And this mapping could go both ways. Policies could be aimed to target a particular social issue, such as increased funding for homelessness services, but on-the-spot fines have potential risks for things like personal rights if they're handed out in ways that target particular groups of people that have historically been disproportionately policed. So we'd note here that the analysis isn't intended to really reveal how well a government is responding to COVID, but instead gives an insight into where policy priorities are being concentrated or require more attention. The analysis that we're talking through for Victoria today is based on a fact sheet that we published initially in July, and it was updated and a new version was released today. And the link to the full paper, I think Rhonda is adding to the chat. And it's a living paper that we're updating as we go with new policies as they're announced. So Victoria has been a big focus in COVID due to its high rates of community transmission and its hard lockdowns over the last number of weeks to stop further transmission. And so when we first look at Victoria's responses to COVID, at a first glance, they look like they're pretty across the board response, especially in areas of social progress where they're already doing well. So you can see that we've used the scorecard with the shading to indicate whether Victoria is performing or underperforming or within an expected range. And then we've mapped a select number of policies here. But however, similar to our consideration of whether an indicator is an input or an outcome, we can't assume that increased spending on healthcare will automatically reduce cases of COVID. It's become clear that when basic health is strongly related to other things, such as precarious or insecure work. And when we have a focus on outcomes, such as reduced cases of COVID, it makes us focus on things like COVID transmission as a systems issue, as opposed to an individual topic problem. Using the SPI also helps us to understand why people living in Victoria and across Australia had concerns over particular policy responses, such as the lockdown of the social housing towers at the beginning of July. While it was a measure that was intended to reduce harm and transmission both within the towers and the broader community, it was also a response that disproportionately impacted people who are Aboriginal, from refugee or migrant backgrounds, living with a disability, or from a lower socioeconomic background. The fact that this was a particular group of already marginalised people that were being disproportionately impacted in the ways that they were able to live their lives with little notice, while others in the community were able to continue under less incarcerated conditions, is certainly an issue of disproportionate impacts on the ability to practice personal freedom and choice equally. As we noted earlier, for overall social progress to improve, all components need to be attended to. So while there is a positive policy response in homelessness and family and domestic violence services, as well as primary healthcare funding boosts, we need to keep in mind how policing or imprisoning responses to COVID pose heightened risks for already marginalised groups in the community. And so while this analysis doesn't tell us where there are groups of people being disproportionately impacted, it can help to direct our gaze towards thinking about societies and as an ecosystem that requires tending, supporting areas where there is already good performance and changing policies and structure where there is underperformance. Having the SBI scorecards can help us think about what can be called wicked social problems by thinking about how issues such as domestic violence, for example, touches on multiple elements of the social progress framework, including personal safety, personal rights, shelter, and personal freedom and choice. And understanding that these different components of social progress intersect and build on each other to improve overall social outcomes.
So also another new application of the Australian SPI that we can show today is using those SPI scores from Australia to give an indication of how each state and territory is progressing towards achieving the Sustainable Development Goals, also known as the SDGs. So for those who are not familiar with the SDGs, they are a set of 17 integrated goals that were adopted by all United Nations member states in 2015 as a universal call to action to end poverty, to protect the planet, and also ensure that all people enjoy peace and prosperity by 2030. So they were created originally as a replacement to the Millennium Development Goals that set out to respond to and tackle global indignity and poverty. So Australia is a signatory to the goals. However, two recognised issues in Australia are that first, a lot of the focus has been on Australia assisting in implementing the goals in developing countries, particularly in the Pacific region. But little recognition has actually been given to the fact that we also need to be ensuring that the goals are being met within Australia. Secondly, there's also no one clear strategy towards measuring and reporting on attaining these goals. So as a consequence, the goals can be seen as something that people can get behind, but then there's also little in the way of measurement that's being put in place to actually track how Australia is progressing towards meeting those goals. So the Social Progress Index framework was originally developed with the SDGs in mind, so that the components can be used to give us an insight into how each state and territory is progressing on the SDGs using a proxy measure.
So when we say proxy, we do so recognising that these scorecard indicators are based on what data is available and appropriate to the SPI methodology. And the scores that are shown here are derived by calculating the average of all the component scores that were judged to contribute to a particular goal. However, this is definitely a first in terms of getting a comparative measure of how states and territories are progressing towards achieving the goals. And similar to the economic peer scorecards, can give an insight into areas where there is more attention needed as a matter of policy priority. So as we can see with Victoria's scores, the majority of the scores across the goals sit in the middle quintile in the range of 41 to 60. There's an exception to goal 2, zero hunger, which comprises the components of nutrition and basic medical health care and shelter, which is performing better, and life below water and life on land, which is performing poorer. And I note that that was because we had particular difficulty getting good environmental indicators across Australia. So any goal scorecard that is based on one indicator, we say, should be treated with some caution as well. And so, yeah, it's important to recognise that finding adequate and consistent environmental data across Australia was really tricky. And so the scores for the environmental goals is really limited. And we identify that as a policy moving forward if we're wanting to really get a sense of how it is that we're measuring these goals in the future.
So what can actually be celebrated then for Victoria? So firstly, Victoria is performing the best in the country on health. So this includes coming first in the components that look at whether Victorians can receive basic medical care, and then also whether they are able to live long and healthy lives. So Victoria had a really high rate of community mental health treatment across all the years that we measured the SPI, so from 2015 to 2018. And then we also saw that there was a really strong funding increase into mental health support during COVID. Victoria also really consistently scored highly on personal safety compared to the other states, indicating that there are really low levels of recorded youth crime, acts to cause injury, and really low physical assaults. So this was quite an interesting finding, particularly given the claims in recent years by several politicians that there is a supposed gang crisis in Melbourne, which was mainly focused on young men from Sudanese backgrounds. So Victoria Police have disputed this claim, saying that young people of African backgrounds only represent a really small portion of offenders. And then also Victoria's high scores on personal safety on the SPI also indicate that this is not actually a prevalent issue, but rather racist fear-mongering and stereotyping. And then it also kind of goes back to that point that Megan mentioned earlier, that perceptions of a place, particularly through media perceptions, don't always tell the whole story of a state.
And now to look at some specific vulnerabilities of Victoria that came out of our interpretations of the SPI. So while Victoria scored quite well on many components, the domain that was consistently underperforming was opportunity, and notably the component of personal freedom and choice. And as Isabella said, we found this really interesting when it contradicts Victoria's progressive reputation. But as mentioned previously, there have been examples which show that the freedom and choice in already marginalised communities in the state are particularly at risk. And so it gives us an opportunity to pause and think about perception versus what is happening in some of these outcome or output data. Victoria also scored quite low across all years on environmental quality. This was particularly because of high levels of water stress, as the drought has hit many parts of the state and in turn negatively affected the farming and agricultural industry. But we'd also note that this has been a challenge across the entire SPI for all of Australia in terms of what environmental data we're actually collecting that can be used in a way to get a sense of what environmental quality looks like for Australia. So we want the SPI to be a tool that can help inform better policy. As I've mentioned, it can function as a tool that can give insight into where there are areas of social progress that are flourishing for particular jurisdictions. And by using a standardised measure where states and territories can be compared, we can better demonstrate where outcomes are quantifiably improving societies. And we believe that everyone can find a component within the SPI that best represents their cause. So if you're a Minister for Education looking at access to both basic and advanced educations in Australia, it should help identify where there are opportunities for development. It also encourages collaboration. So we want this to be a tool that can help governments to partner with the not-for-profit and for-purpose sector to partner on shared causes as represented by components of the index, and to help identify opportunities to work together to achieve common goals. So the first Australian SPI provides the beginning of a conversation about how we could measure social progress within Australia. As a first step, it's a tool that is using best available data to demonstrate the extent to which basic human needs, foundations of wellbeing, and opportunity are playing out across Australia's states and territories. It helps us to shift our attention away solely from economic indicators of measures of progress, but instead start talking about progress in terms of inclusive growth. Looking into the future, there's lots of ways that we can use the Social Progress Index to look deeper into Australia's social progress towards achieving basic human needs, wellbeing, and opportunity, and for the people that live here. At a more local level, we could, for example, calculate a sub-state SPI, for example, focusing only on Victoria, but drilling down into more granular data and seeing how things look across different communities. I mean, ideally in the long-term future, we would love to create a national SPI at a local government level, which would allow us to compare the scores across these smaller regions and provide greater insight into exactly where in Australia things are progressing well and where they are not, and on which components. In particular, it would allow us to compare between metro and rural areas, which we know can differ greatly in their levels of social progress, but unfortunately cannot be disaggregated in our current Australian SPI. While the lack of data at this level currently makes calculating a local government index difficult, another option is to create a framework only. And these are some conversations that we're starting to have that are really excited, we're really excited about. So here we would map different indicators that align to the SPI components, but aren't currently being collected consistently across the country. We see community engagement as an important factor in each of these, where we would make sure to include community voices on what social progress means to them, what is important, and where we are planning to go as a society. And on that note, we're very keen to hear your thoughts and your feedback based on what we've talked through with Victoria at the moment. If there's particular areas that you'd like to drill down into, any questions that you might have about the methodology or going back to particular slides, etc., feel free to put them in the comment box. I'll also flag, as Rhonda mentioned, we are going to be presenting a webinar every day this week. And Rhonda will put in the chat that the registration link to all the different states and territories. And we'll also make the scorecards available as well that you can look at in more depth as well. So on that note, I might hand over to Rhonda to facilitate the Q&A.
Yes, we've had a few questions, which is great, but I encourage anyone who has any comments or questions to pop them in the chat feed. A lot of people, or a few people, are keen to know if the data or the framework of indicators are publicly accessible.
Yep.
Yes.
Yeah.
So, yeah. So we do have a methodology report that has all of that information and all of the indicators that we used. And you can get that through the link that I believe Rhonda put in the chat. Yes, the link there.
It is there. I can add it again. And that's to the SPI URL, right? Yeah. So I have it in the chat feed.
Cool. The other thing I'll note with that as well that we might not have made clear is that we didn't actually do any data collection ourselves in this. Part of the methodology requires that these are indicators that are already being collected, and we're just doing the secondary collection. And this was data that was publicly available. We particularly love the Australian Bureau of Statistics and the Australian Institute of Health and Welfare, but there's also things like the Hilda survey, household income and labour dynamics of Australia, which gave us some more of those community engagement insight indicators as well.
Saint Max wants to know the same for the classification mapping to the SDGs. Is that available?
So that one we can make available. This was definitely a qualitative exercise in terms of looking at what indicators we use to make up each component and whether those indicators map to particular goals. And so that might vary when comparing the Australian SDG scorecards compared to the global SPI and their SDG scorecards, just because the indicators are slightly different. We haven't made the SDG methodology available just yet, but we're planning on publishing that in the next few weeks. So today was kind of a sneak preview.
Indeed it is. First day of the series. Someone's asked if we could circulate the recording. Yes, we are recording all of our webinars and they will be available from Monday next week. But to those that have registered, I will email you personally with the link first. Dale has a comment and a question, maybe I'll read it out. Interesting results read the worst performing. 3 of the 4 are qualitative data, numbers of social housing, etc., where the 4th asks for perception, feelings of safety. People may not feel safe, but that is also in contrast to the physical assaults and youth crime, which Victoria performed better on. Interesting to know what makes people feel safe or unsafe.
Yeah, I think that's a really interesting and valid comment. And I think it goes back to that point in terms of how it is that we measure data. And we rely a lot on sort of those outcome indicators that might come through in terms of, rates of physical assault and things like that. But that's a very administrative data issue, right? And those are the ones that can be much easier to capture because they're already being collected. But it's those perceptions and things like that that are really important to also be capturing. And we found in a related point, sort of when we were trying to find indicators that would fit within the opportunity domain in terms of personal freedom and choice, and do people feel like they can be included and participate in their communities, those were the ones that we actually found were being collected less consistently, or weren't being collected at the level that we could actually include it in the index, just because there wasn't a great enough sample size and things like that. So we're saying from this that there is definitely a need and an opportunity to be focusing on it's that experience of living in society and measuring that as well, and getting kind of a clear definition of what that looks like. And I think that consultation process is a really important way of people being able to have their say of what matters to them when they're thinking about inclusiveness and what makes them feel included. and how can we start measuring that in a way that can be incorporated in future indices. Is there anything you'd add to that, Isabella?
No, I think, yeah, it was something, a kind of conversation that we had throughout the whole process of kind of creating the index, that, you know, there were areas that we really did want to find indicators for. So yeah, experiences of racism and just kind of, really finding examples of the way that people feel, particularly marginalized communities, which we couldn't necessarily find. But yeah, as Megan said, this is something that hopefully in the future, when things do get measured more, we'll be able to include in future iterations of the index.
Christian asks, what was the most surprising or unexpected finding?
Honestly, for me, the most surprising in just the whole national index was Victoria's lower scores on personal freedom and choice and opportunity. I think that was something that, you know, as a lot of people obviously have, where I just had this broad assumption that because I see Melbourne as a really progressive city from the outside, that must automatically translate to the data. But I think for me, that was really eye-opening to kind of reflect on, you know, my personal privileges as well, of just being able to see something from the outside and assume that everyone has a lived experience similar to mine. So yeah, I think for me, that was the most surprising and unexpected result. How about you, Megan?
I think, and this links to the SDGs a little as well, is, you know, we mentioned that the SDGs came on as a follow-up to the Millennium Development Goals, which was so focused on decreasing poverty and improving medical care. And largely across Australia, we saw that any indicators or components that were to do with access to medical care or health and wellness were in general the better performing components. So it suggests that having those goals is actually useful at directing attention to solving social issues such as poverty, food insecurity and things like that. We did see, and we're talking about this later in the week, that Western Australia and the Northern Territory performing 7th and 8th each year. And there was actually a very big difference between the scores of Western Australia and the Northern Territory. That was quite surprising to see that come through in the model. And the other thing that we did with that as well was looking at how it is that gross state product per capita correlates with social progress index scores. And so what we would assume, if it's that kind of trickle down economic effect, or that economic progress automatically equals social progress, is that we would see a positive correlation with, as GSP per capita goes up, so does social progress index scores. But we actually saw a negative relationship in that Western Australia and the Northern Territory have some of the highest gross state product per capita, but also the lowest SPI scores. And that's largely through things that aren't in individual control. It's due to things like mining and exports and the fact that there's a lower population. So I think that was really interesting for me, just to kind of see that demonstrated when we're looking at kind of these outcomes of how we're trying to measure social progress, and seeing that, yeah, just this focus on the economy only, and assuming that if things are good at the GSP level in general, we can't assume that that means that it's automatically creating a socially progressive or safe society for the people living within those communities.
Simon makes a comment, perhaps Victorians have a high expectation when it comes to personal freedom. So whilst actual personal freedoms might be good, the perception of them might be lower. I'll go on to a question from Connor around the SDGs. Was the SPI mapped at a high level to the 17 SDGs or to more specific SDG targets and indicators?
So just at the 17 goals rather than the specific targets, because I believe there's a large number of specific goals within them. Yeah, and I think the other thing is to recognize that the SDGs does have an inherently economic component within it. When we're talking about zero poverty, that means that people have enough money to be able to afford basic human needs and things like that. So it's not necessarily that the SPI maps exactly onto it, but it is giving us an insight into looking at what are the actual outcomes when we're trying to measure the Sustainable Development Goals and how we're going towards achieving them. Because I think what we found at the moment is that on the DFAT website, we're very good at kind of measuring indicators in terms of, the fact that we have universal healthcare in Australia means that there's an assumption that there's adequate contraception available to all women. But if we're not actually measuring what that looks like, we can't actually say that we're achieving that goal or not. So it kind of directs our attention that way a little bit as well.
And as you mentioned, the work that you're doing in the SDGs is quite new.
Yes.
Yeah.
And ongoing, and it's still being developed at a global level as well. I mean, some of the work with the latest Global Social Progress Index that's come out, they've been able to do some modeling, and it's based on how the world is going at the moment on overall social progress. We're not projected to meet the Sustainable Development Goals until 2092. And these are goals that were originally set for 2030. So having numbers like that can just sort of be a little bit of a hold up, we need to reevaluate here. And so we're hoping that this can be sort of a similar action when we release these more broadly in Australia.
I'll also, in the follow-up email, share the link to those broader global results as well.
Thanks, Rhonda.
From Rosalind, does the methodology include what data sources were used in calculations?
Yes. Yeah. And we're very happy to share, I mean, all the data is publicly available, but we're very happy to share sort of our collated versions, and the methodology includes things like the weightings and stuff like that was used as well.
And that's on the SPI site as well, right? Yes. I'll also share Megan and Isabella's email addresses, links to share if you've got any further questions. Another one from Dale. Can you explain what goes into access to further education and how federally funded programs are delivered and supported in an inequitable way? Does this inequity is it driven from the federal, state, neither, both? Sorry, that's a bit wordy. You might want to read that.
Do you want to have a go with this one, Isabella?
Well, just in terms, I've just pulled up here the different indicators that actually went into to kind of answer the first part of that question. So the different indicators that we use to calculate the score for access to further access to advanced education was post-high school enrolment, so the proportion of the population who are attending higher education, the education attainment per population, also the population of young people who aren't fully or partially engaged in employment or study. And then we also looked at an indicator that was the gender parity in higher education achievement, so proportion of women with a bachelor degree as a ratio to men.
So I would add to that, it is tricky. I think that Dale has asked a really good question in terms of identifying whether something is due to a federally funded initiative or whether it's state funded. We would suggest that maybe it is that if a state is underperforming on something like access to further education, that is something that they need to be paying attention for, either in lobbying for better funding from the federal government or addressing with their own state programs. The other thing is the issue of data. So we wanted to be able to include things like what is the achievement rate in terms of equality between, for example, Indigenous and non-Indigenous people, or people from migrant backgrounds. But again, that was largely data that isn't readily available. And I think what can help with that is if we are talking to experts in, for example, further education, if they can be telling us what they see as drivers of inequity, or where they see issues in terms of the actual practice of delivering higher education, that can help us start thinking about, well, what are indicators that we should be or could be collecting that would help capture this better? And so that helps us go through a process of refining and revising and hopefully creating a framework that best represents the society that we want to have. And if we're not already collecting those indicators, then we can sort of be advocating to do that in the future.
Wonderful. That was our last question, unless anyone else has a last minute one they want to get in there. Is there anything else you'd like to add, Megan or Isabella?
I think
what to add from me?
No, I think I just the Social Progress Index is truly one of the joys I think that Isabella and I really have, just to be able to present it and talk about it. the fact that we work so closely with the Global Social Progress Imperative as well. It's a fantastic network. They're doing work across the world, both at sort of local government levels, but also country level. So I definitely recommend checking out their work. And we're definitely keen to keep conversations going about, you know, how is it that the Social Progress Index can be used even just in your local council area. You know, we can have conversations about developing a framework that would help create an agreed measure or agreed kind of framework and understanding of social progress. So we are never done talking about SPI. So definitely get in touch if you would like.
Megan and Isabella love it.
We do.
We really do.
Well, thank you very much to both of you. It's a lot of work to pull these presentations and the actual tool together. It's huge. So thanks so much on behalf of everyone. We do encourage you, if you're interested in other states and territories, which we hope you are, to come along to our other webinars this week. We've got 5 running, 1 of 5 we've now done. And you can head to impact2020.online to check those out, and also other webinars that we have coming up. We do them normally on a monthly basis, but this time it's a week-long one. And that is all from me, and I thank you all again. I will be in touch. Just give us a few days for the recording. Thank you so much.
Thanks,
Bye-bye.
everyone.
Thank you. Bye-bye.